Did I just pee myself or did my water break? If you're pregnant, you might be asking yourself that question and know that you're not alone. If you're curious about what your water breaking might look like for you, I'm here to break it all down. If you don't know me, my name is Julia. I'm a birth doula and hypnobirthing educator, and I created this channel to encourage women to learn more about their bodies and have more positive birth experiences. So, first things first, what actually is breaking? In pregnancy, you have something called the amniotic sac, which is this protective bubble of fluid that surrounds your baby, and your water breaking is that bag of fluid releasing. Now, Hollywood and all the major TV dramas will have you think that this is the most chaotic experience where you just have this big gush of water in the middle of Target and bam, you're in active labor and everything's hectic. Could it happen like that? Sure, but more often than not, it's a lot slower. It's a lot calmer. A common question I hear is, how do I know if I pee myself or if my water is breaking? The two can feel like a very similar sensation, but there are a few key differences. Amniotic fluid is usually clear and odorless, where urine sometimes has a smell and has a little bit more of a yellowish tint. And usually when your water breaks, it keeps leaking. You can't help it. Whereas if you are peeing, you can usually stop that sphincter and stop your urine from coming out. Whereas with your water breaking, you can't. Now, your water breaking is one way that labor can begin, but it's actually not the most common way. You can even be in active labor for several hours and your water not break. I've supported women who are 7, 8, 9 centimeters dilated well into transition, and their waters are still intact. That's completely normal. Some babies are even born with the amniotic sac still intact. That's called in-call birth. Very cool if you've never witnessed it, but it is very rare. You might hear your provider using terms like SROM, AROM, or PROM, and I'm going to break each one of those down. SROM, or spontaneous rupture of membranes, is when your water breaks naturally, all on its own. This is probably the one that everyone pictures, your water breaking naturally, either at the beginning of labor or somewhere along the way. But I think it's something like only 10% of births start with your water breaking. A lot of times it happens when you're deeper into active labor. Again, completely normal. Just because your water breaks doesn't mean you will immediately be into active labor. You might feel a small pop or some pressure. You might feel that big gush or a slow trickle. If you're wearing a pad, you might need to change it regularly. But again, it's usually pale or colorless and odorless. AROM is artificial rupture of membranes when your provider takes something that looks like a crochet hook and pops your amniotic sac. And then there's PROM or PROM, which is premature rupture of membranes, where your water breaks naturally, but after 37 weeks, and your contractions haven't started yet. If this happens, most women go into labor within a 24-hour period, but it can feel tricky. You can feel like, oh, things are happening and get excited, but your contractions never start. You might feel pressure to start Pitocin or other intervention methods you never thought you would have to experience. So I would discuss with your provider what the timeline looks like and how you can mitigate risk. So we have SROM, where your water breaks naturally, usually in labor when you're already starting to have contractions. We have AROM, where your water is broken for you. And we have PROM or PROM, where your water breaks but your contractions haven't started. Let's talk about the benefits and risks of each scenario. If your water breaks naturally, that's an amazing sign that your body and your baby are ready for labor to occur. Usually when your water is broken, you're put on a strict time clock, usually in a 24-hour period. I've seen providers where it's a 16-hour time frame they want your baby to be delivered. I've seen others where they push it to 36 or 48 hours, but usually it is within that 24-hour time they want your baby delivered. But that's a good question to ask as you're interviewing your providers. Once your water breaks, what is their time frame? Now with AROM, it's usually done to help speed up labor or get better access to internal fetal monitoring if they have any concern with the baby's heart rate. Another risk is umbilical cord prolapse, where the umbilical cord slips out before your baby's head. This usually happens because baby is still pretty high up in the pelvis. So a good question that you could ask if you are consenting to cervical exams is, what station is your baby? Are they engaged in the pelvis? Are they low enough that they're not worried that the umbilical cord might slip out? Once your water breaks, your baby loses that protective cushion, and usually it makes contractions that much more intense. And with any internal cervical exam, once your water is broken, there is the increased risk of infection. Now with PROM, your water breaking before your contractions start sometimes gives women peace of mind so that they can mentally wrap their head around gearing up for later. For others, they're like, I want this to start. I want to meet my baby already. The thing to remember is you don't want to be in fight, flight, or freeze mode. You want to stay in a deeply relaxed body and mind. So give yourself some grace and space regardless of how your labor starts. As a reminder, most first time women do not experience their water breaking as a first sign of labor. Hollywood has really distorted our perception of what labor can look like and how it starts. Again, we want to keep you out of that fight, flight, or freeze mode. We don't want you all amped up or thinking, okay, this is it, here we go, or stressing that your water hasn't broken. Again, giving yourself time, space, and grace to let yourself relax regardless of how labor starts. Keeping the amniotic sac intact as long as possible often makes the contractions more manageable. Think of it as your body's way of pacing labor. So, how can you navigate your waters breaking while still wanting a low intervention birth? I think the first thing you can do is ask your provider questions. If your provider mentions AROM or induction, ask them, why is this medically necessary? What are the benefits, risks, alternatives? What if we do nothing? And listen to their responses. It's really important when you are interviewing your providers to listen to what they're saying. And are you comfortable with what their standard of care is? Another way to navigate your waters breaking is to stay at home as long as possible, with the caveat that everything is quote normal. It's that clear, pale, odorless fluid, and that you're in good spirits. But staying at home allows you to rest, hydrate, maybe have a meal before you go in, and really center yourself before labor starts. And again, limiting vaginal exams so you can decrease the risk of infection. And I think most of all, it's trusting yourself, trusting your intuition. Listen to what your body is telling you. Oftentimes, we just have to pause so that we can understand what our body really needs. Remember that your water breaking doesn't have to be chaotic and hectic. It can be slow, quiet, and just another sign of your labor progressing. Or it might even surprise you when you're 7 centimeters dilated and you feel a little pop. Your body is intelligently designed to labor and birth your baby. Trust that. You are so much stronger than you can even believe. I believe in you. I want you to believe in you. If you want to dig deeper, learn about your options and how you can have a more positive birth experience, I created the pregnancy prep packet, which you can find at the link in the description box below. And that's all for me today. Please like, comment, and subscribe, and I'll see you in my next video. Bye, guys.